Welcome, everybody. Today we're talking about alternative pain and disease management with Dr. Stuart L. Weg of Patients Medical, and he's an alternative pain management specialist. My name is Megan Franzen. I'm a patient care supervisor here at Patients Medical, and we do a wide variety of different webinars on many different holistic medical topics, but we're really excited to speak with you today about alternative pain management with Dr. Weg. And he's a really unique physician with some groundbreaking protocols that, if you have chronic pain, you really want to listen to this. So get your friends and relatives, your neighbors who are in chronic pain, and get them to listen to this webinar with you. But first I'm going to talk a little bit about Patients Medical, who we are and what we do. Patients Medical is a holistic medical center. We are full service, means that we have multi-specialty physicians here. So we have a variety of different specialists who are holistic medical doctors and also different practitioners as well. So if you're curious, go to our website. You can see it at the bottom of the screen, patientsmedical.com. And it'll give you a little bit of insight on how we help our patients discover health and rediscover vitality. So many people, especially here in New York City, are walking around every day and they don't even realize that they're miserable until they come and see one of our holistic medical doctors and they start feeling so much better. They actually start feeling vital, even after just implementing a few of the minor changes that the doctors might recommend with diet, with lifestyle, maybe just a natural remedy or treatment protocol. And then people end up waking up feeling full of energy and optimism for the day, having energy throughout the day and more willing and aware of positive choices that they can make that will benefit their health and well-being. Energy after work to cook a healthy meal or spend time with your loved ones. These are things that people didn't have before, that once they get in touch with our holistic doctors, they're actually finding that these things come quite easy to them, and boy, are they happy. Our doctors actually focus on the root cause of symptoms. So instead of just asking you, okay, what are your symptoms? Here's a drug that's going to mask the symptoms, and call me back when it doesn't work anymore. Our doctors actually want to find out why the symptom is happening. So why is the pain happening? And actually heal that root cause instead of just covering it up. Because as we all know, our bodies are always going to give us another symptom if we cover up the first symptom. Our doctors integrate modern medicine with holistic practices. They use natural supplements and alternative protocols, and Dr. Weg is going to tell you a little bit more about that in a few minutes. Our goal is actually to promote healing and prevent disease, a novel approach in this day and age, but wouldn't it be nice to head the disease off before it happens instead of waiting until you get sick? Well, this is what our doctors actually do here at Patients Medical. They collaborate to approach each patient holistically, which means that the many different specialists actually get together and confer on treatment protocols. So that means that you actually have a wellness team on your side instead of getting the runaround, going from appointment to appointment at different establishments. And I apologize for any external noise in the background here. We are very centrally located in Midtown East Manhattan on 42nd and 2nd Avenue, but unfortunately the price we pay for that is hearing a little bit of traffic noise outside. The result? To gain health and nutritional wisdom that can be applied for years to come. So that means that when you come and see a doctor here at Patients Medical, they're not just going to hand you a prescription and say good luck. They're actually going to give you techniques, not only for your diet, but also for your lifestyle and many other approaches to your wellness that you can apply to your entire family. You can use for your kids, your mother, your father, grandparents. All of these people can benefit from the wisdom that's being shared by our holistic doctors. The founder of our center, Patients Medical, is Dr. Warren Levin, and he began practicing his groundbreaking holistic protocols in 1974. And he doesn't actually work here. He actually moved out of state, and our medical director, who had been working with him, took over the practice, and now it's called Patients Medical. We've been in this location since about 2005, and it's grown from just a private practice for Dr. Rashmi Galati, who's our medical director, to a multi-specialty medical center with state-of-the-art protocols that, again, we'll talk to you about next. We treat all kinds of conditions from A to Z. Here is just a short list of the different conditions we treat. And our staff includes internal medicine, family practice, gynecology, osteopathy, oncology, of course alternative pain management, which we're going to be talking about, pediatrics, plastic surgery, nutrition, kinesiology, reflexology and Reiki, oriental medicine and acupuncture, and homeopathy, among other things. So we believe that we are the definition of integrative medicine here at Patients Medical. We integrate the best of Western medical technology, the cutting-edge, groundbreaking protocols, with the holistic perspective in that their doctors want to look at the whole you, the body, mind, and spirit, and heal from inside out. We put those two things together, and you get Patients Medical. So now I want to tell you a little bit about our speaker, Dr. Dr. Weg. He's an alternative pain management specialist here at Patients Medical. He actually started with an internship at Memorial Sloan Kettering Cancer Center, a residency at Beth Israel Hospital, a preceptorship in invasive pain management at Texas Tech U. In 1982, he began treating chronic pain patients, so you can see he's been in the pain management business for a little while. In 1993, he was certificate number 423 in pain management issued, and that's very significant in that he was among the first to receive this particular type of distinction. In 2005, he was recertified in pain medicine, and he's the holder of various U.S. and foreign patents on pain management innovations and discoveries. And he conducted frequent lectures and online events with AOL. For those of us who remember those chat room seminars, he was actually one of the stars of the alternative pain management chat rooms on AOL, and is still very, very active in his field. The specialties include detecting the root cause of pain, using alternative pain protocols to treat instead of just merely covering up the symptom, oxidative therapies, and many other things that he's actually going to address actually right now. So Dr. Weg, welcome. Thank you so much for joining us.
Nice to see you.
All right, so let's just dive right in and talk about safe and effective solutions for treating chronic pain. Now, so many people are out there, and they are really, really suffering from chronic pain, and they're on drugs, and they don't know what to do. Tell us a little bit about this. We're going to be talking about chronic pain versus acute pain, expected pain, normal pain. Demystify this for us a little bit. Tell us what this is about.
Sure, Megan. Well, if you've gone and fallen down and bumped your knee, then you've got acute pain. Now that's a different thing. That's treated with ice and maybe medication for a few days, and it should go away, or it will not go away, and you'll go in and go into your orthopedist, and he'll order some tests and make a diagnosis and hopefully develop a cure for you. Well, that's sort of expected. You have a knee surgery, you come out of surgery, again, you expect some pain, but you don't expect it to stay with you. You heal up and you move forward. This is a normal process, and I don't treat these things because this is the normal process. When you get out of the normal process, now you wind up with chronic pain. You've had an operation or you've had a diagnosis, and things haven't gotten better. Here you are 6, 7, 8 weeks after whatever happened, and now you've got pain. And somebody's done something, somebody's tried a therapy for you, and it hasn't really helped. Pretty soon you're in a chronic pain basket. Now, maybe you've been put on medication. Maybe you've been forced to take strong medicines to allow you to return to work and continue what you're doing. Before you know it, you're taking potent opiate medications. You're concerned because they're affecting the way you think. They're affecting you because you need them. And you have really walked yourself into a corner. And these are the patients that I handle.
Without even knowing it, right? They never even expected to be in this situation.
Well, nobody wants to get sick, and nobody wants to be in chronic pain. Nobody wants to be taking strong pain medicines. But this is what happens. This is if the mainstream approach is to try some things. It doesn't work, go on medication, and you'll be better. And out the door you go. And you're not better, and unfortunately time goes by, and I get calls from people all the time. What do? I'm on my Percocet, I'm on my Tylenol 3 or worse, and they're stuck. Now they're married to the doctor writing the prescriptions. They're married to the doctor because that's the only thing that their insurance company will pay for, and they're in a bad way.
Mm. Yeah, that's a real bind for a lot of people. So Dr. Weg has a different approach. So if that's where you are, then Dr. Weg has a better approach for you.
Well, if you're already in the basket of chronic pain, then I have to unpeel the problems and get you better. On the other hand, if you had an injury and you use the same protocols, you probably won't get into chronic pain and you'll heal up. So it's the same approach. The approach is to get the area healthy and allow you to heal up and get off your medication or never get on it.
Much better to never get on it, right?
Right.
So tell us a little bit about early 20th century pain.
Well, in back around the turn of the century, there were a lot of cures that were out there. And people understood what they did, and sometimes they didn't understand what they did. And there was no such thing as alternative. There was traditional, there was natural, there was homeopathic, and there were medical schools for these things. Around 1910, there was a report issued by a man named Flexner, and he only found certain things were what he felt were scientifically supported, and the others were all tossed in the trash. And they threw out the baby with a lot of bathwater. There were a lot of good things that they couldn't understand that were thrown out. Well, these things have remained with us and built upon. And some of these things I use that were old and some are new, but they're not considered mainstream. Now, if you ask me, well, sum up what you think. And what I began to think is, I began to go back to the old thought process back in the 20s and 30s when arthritis was considered a joint infection. And people were considered to have dental infections that were affecting their joints. This was considered a very important thing. And antibiotics were used way back then. And this all changed, though. This all changed when cortisone was discovered, and it was discovered around the time when John F. Kennedy was suffering from back pain, and he was given cortisone, and he got immediate relief of his back pain and was able to go ahead and function. Of course, we have no idea what would have happened with Kennedy if he had continued, but the short-term beneficial results of a steroid cortisone injection were recognized around that time, and the entire paradigm shifted to that medication.
So JFK was the poster child for cortisone shots, huh?
Yes, yes, he was. And in any environment, when the king gets some treatment, everybody follows. Well, as time went on, technology advanced, and surgical and chemical techniques began to come into vogue. And it got in vogue that we should destroy nerves or stimulate brain tissue, and this is still being attempted, but it's not really helping. We're not getting anywhere where we need to go. And And what happened was after World War II, they began to inject people in pain with local anesthetics, and they got some results that were good. But what this got confounded with was when they discovered cortisone, and they said, well, why don't we put two and two together, and we will get local injections with cortisone. And as I already mentioned, this is what John F. Kennedy got. And this has become the gold standard of treatment today. And I review cases from all over the United States, and I see the first thing that the doctor does is give the patient a cortisone injection with local, no matter what the problem is. If it's his wrist, if it's his knee, bang, in goes the local and the cortisone shot in the back. And once that happens, an entire process begins. And in this slide, you can see that there's injury. And normally, after a person has an injury, if you bump your knee or bump your elbow, you get inflammation. It swells up. And you get reduced blood flow, and the tissues get starved. That's called tissue asphyxiation. And if this isn't corrected, you get nerve damage, and the nerve damage becomes chronic pain. So the thought process was, if you could block the inflammation using cortisone, you could stop the entire process. And it really made a lot of sense, except it was not right. So what happened was, they followed that paradigm. They gave local injections of steroid and local. That failed. Then they moved on to nerve destruction with chemicals, with microwaves, with freezing, to see if they could stun the nerve or kill the nerve. And that didn't work either. So now you had failures, and I'm sure I'm talking to some of these failures. So they put the patient on long-term narcotics, and they felt that that was the best solution at the time. However, subsequently, since I've actually made this slide, the authors of point number 3 have actually reversed themselves, because they now feel, and this is in the last few months, that long-term narcotics actually make the patients worse. Next one.
Well, I guess that probably isn't any stroke of genius, right? Probably anybody could have figured
well,
that out,
you know,
I suppose.
It's finally simmered to the surface. Something that myself and some of us have known for years is that patients do not do well on long-term opioid management. And the reason for that is the same reason that they don't do well on steroids, which we'll talk in a minute.
All right.
So what we need to go back and look at is that these steroid medications, they are not supported with long-term studies. And even the short-term studies are very weak. And the local injections only benefited a small number of patients. And the nerve destruction that we talked about recently, that only even in the best hands only gave temporary relief. It got worse. An increasing number of patients fail, and they wind up on the long-term opioid management, and that's what I'm seeing all over the place. And the insurance companies are aware of this, and they've been denying payment for these treatments. Where do you go? I mean, your insurance company is saying don't do that, but what do you do? So that's what we're going to talk about today. And one has to ask themselves, with all this science and that I've said, and steroids blocking the inflammations, why can't we control the inflammation? If we're giving a steroid, why doesn't it help? Why does the inflammation always return? And then if we destroy the nerve, how come it only helps temporarily? And then if you have chronic pain and you've been under mainstream management, you're going to know that your pain's getting worse, and it's moving around. It's moving to other areas that never had a problem. And you'll get explanations. Well, it's because you're walking funny, so that's why your knees are breaking down after your back hurts. I've heard that one. There are other reasons, though. And you might ask yourself, why do the chronic patients need more and stronger medicines? Well, as I just mentioned, now the experts that told us to put patients on opiates now finally appreciate this. But where were they for the last 20 years? And why don't chronic pain patients just improve? Isn't it amazing? I mean, people get hurt and get better all the time. How come you didn't? Why aren't you just healing up? What's stopping you from healing? So why are all these mainstream treatments so useless for so many patients? And here's the issue. Could these treatments be making you worse? I mean, no one talks about this, but I believe that. Could these treatments be preventing you from healing up and getting better? Could the steroids be actually making you worse? No one asked this question. You know, yet you go and you go in, your doctor will say it couldn't hurt, let's give you a steroid shot, maybe you'll feel better. I hear this every single day in my practice. The doctor said it wouldn't hurt me and maybe I'll feel better. The answer is you won't feel better very long, and yes, it will make you worse. And could the need for stronger drugs not be addiction? Could it be because you're getting worse? Everyone says, well, I mean, he gave me Percocet and I started with one, but now I have to take two because I'm getting tolerant of it. Well, could that be that maybe those drugs are making you worse? Maybe the disease is getting worse? No one's thinking that until now, until recently. So when I looked at this, and I've been looking at this since the 1990s, there's something missing from this picture. But I didn't know what it was. But I knew that this should not be. So in 1993, one of my New Jersey patients that I was not helping went to an alternative doctor in New York City. Not me, she went to someone else. And she got tremendous pain relief from taking intravenous hydrogen peroxide. And I was astounded. I didn't understand this. And this intravenous peroxide treatment was used in 1920. It was a vintage infection treatment that they used for the flu in India. And this patient had bladder pain, and the bladder pain went away. And she talked around the practice and said, I feel better. And pretty soon my whole chronic pain practice was after me. Could I please give them this treatment? So I did. I gave it to them. And at first I gave it to just the bladder pain patients. And these folks were on opiates because that's all we could offer them. And they started talking, and the patients who had other pains said, well, what about me? Why don't you try it on me? So I tried it. And this is what happened. This is a study that I put together. I was so astounded by the results. I collected 57 of my patients who had had the treatment. There's a total of 500 drips I gave. 2/3 had significant improvement. Now, when I say significant, they didn't just have a little improvement. If they had a little improvement, I didn't even count that. 2/3 had significant improvement, better than just a little. 86% reduced their pain medicine, and nearly 100%, all but one man wanted more treatment. And the significance of this study is nothing here is very important to look at because, I mean, these people were getting opiates from me. I was writing scripts for them. If I would have told them, please jump off the roof and, and see if you feel better, they would have had no choice. Because and you may be in that situation. You may be getting medication from a doctor, and you'll do whatever he tells you to do because you need that medicine. But 86% reduced the medicines that they were asking me for. Now, you cannot get patients in chronic pain to reduce their medications voluntarily.
That's unheard of.
That does not happen. What has to happen is if you want the patient to reduce, you have to get them in the office, you have to sit them down, you have to tell them, look, your insurance company wants you to take less, I want you to take less. There's moaning and groaning, and please, I'll wean you off. That didn't happen. 86% just stopped taking their medicines. We had patients who went into withdrawal by accident. That doesn't happen. Patients do not go into withdrawal by accident. They go into withdrawal when they're pushed into a corner and they have nothing else to take. Here I am, patients who don't feel pain and they're reporting withdrawal symptoms, and I have to tell them take one or two of your pain medicines to stop it? No. This was very significant findings. So significant that I reported this at an anesthesia meeting, and it was published in 1995 in a specialty magazine. Well, the other side effects tipped me off on what I was dealing with. Patients who had back surgery or bad joint replacement, any wounds, it opened up and pus came down. And I cultured the pus that came out of these surgical wounds, and it was positive for infection. And the people who didn't have pus running out of wounds, they got fever and chills. Something was going on inside them. And some patients who had chronic fatigue symptoms or had no signs of, no focal problems, they had sinus drainage. My ladies that had interstitial cystitis, they all started coming out with positive urines, pleural urines, and they all got better. There's no way you can deny this, that you were dealing with an infection in all these patients.
And not only are we going to see pictures of this later on in the seminar, but Dr. Weg, correct me if I'm wrong, but you actually experienced the same kind of phenomenon yourself in your own body, too.
Of course. I always tested everything on myself, and I had some chronic issues, and those chronic issues demonstrated the same issues. I had fever and chills. I had things opening up and little pustulates developing. Sure. And we continue to see this, and when we challenge patients with an anti-infective approach, we do get the body fighting the infections as they feel better.
Great.
Well, I began to develop an anti-infective approach, and I then began to collect information and conversations with other doctors who were using things all designed to treat infections. And there is a group of doctors that are using minocycline therapy to treat arthritis, and that goes back, way back to the 1930s, and it's still effective. Doxycycline and other antibiotics were being used to treat Gulf War syndrome. I looked at this, I investigated this, I incorporated it into my practice, and then I began to talk to the other people using oxidative therapies. And as we already discussed, peroxide is an oxidative therapy, but there's also ozone and ultraviolet therapy. So I began to use all of these modalities and mixing and matching and tailoring them to the individual patient, and they all worked. And the reason they all worked is because information, it's just undeniable when you've seen the patients. Sitting here talking to me, you say, well, it sounds good. But if you were another doctor, if there's any medical professionals in this conference listening to me, if you were next to me and you saw a patient come in and you saw what I just saw, there's no way that you could deny that patient was infected. And you'd have to finally, after you see one after another, accept the fact that chronic inflammation is probably a chronic infection, and probably is one and the same. So now that we finally summarize our discussion, there's 2 points that you need to come away with. Mainstream conventional treatments are not working for most patients. Sure, I now use the term conventional pain management is a Ponzi scheme. And the reason I say that, because if you're young and healthy, you sprain your back, you go in, somebody gives you a steroid pack or a steroid shot, you feel better, you get better, and in your short life, a year or two is a relatively long period of time for you when you're in your 20s or your teens and so on. But you'll be back. You'll have a degenerative disc disease. Your spine has aged quickly with that steroid shot. On the other hand, after your second time back, you're going to realize that these things aren't working, but it's too late. You're already in the conventional treatment. So we come away with the fact that mainstream conventional treatments are not effective for many patients. And the other fact you need to come away with, and that's based on my observations, is that chronic pain is caused by an injury or a lesion that cannot heal because of infection in the tissues. And here's a picture of the same slide you saw earlier, but really what's happening. You get an injury, you get inflammation. Now somebody gives you a steroid, a cortisone shot. Well, the cortisone shot stops your body from fighting the infection. So you might get a little less swelling, and you'll get less. But the infection now attacks in the tissues that have reduced blood flow. And you get affected, and you get attacked by bacteria that like low oxygen tissues. Now, it's a perfect situation. The bacteria is sitting in your teeth or in your bowel where it doesn't get much oxygen. Now, it goes into the bloodstream. Next thing you know, it finds a bruise that's swollen. There's less blood flow, low oxygen. This is a great place for me to make a home. So it settles in the tissues. It might turn into low back pain. It might turn into fibromyalgia. There's a whole bunch of diagnoses. It might turn into reflex sympathetic dystrophy. Eventually, it causes more tissue destruction, more of the same, eventually causing nerve damage and more chronic pain. Now, somebody else gives you another steroid shot. It doesn't make it better. It might make you feel better for a little while, maybe a week or less. The more you do it, the less it's going to work, but it makes the chronic pain worse and more permanent. Now,
here it is. Here are the slides.
Here's a man who, at this time, he was in his 20s, and he got impaled with a garbage truck after he was throwing garbage, and he got impaled. And 5 years earlier, this is. And they sewed him up, and they cleaned him up, and they put a skin graft over it. And he was doing fine, but the pain never went away. And eventually what happened was he became in chronic pain. And they diagnosed him as reflex sympathetic dystrophy, and I thought that he should be treated mainstream-wise, and I did treat him. But then I started using my alternative oxidative therapies, and to my surprise, this wound, which had been closed for years, suddenly opened up, got red, and eventually, you don't see this slide, there was culturable bacteria coming out of this wound.
Wow.
Years later. Okay? The story did not end well, though. What happened was he was on opiates, and suddenly he had extra opiates around because, you take a young guy, you give him a vial full of opiate medicine because he's needed this for so many years. Now, Dr. Weg figured out why he's in pain, and he's got an extra bunch of opiates, and he begins to sell them or play with them or hand them out. He became inappropriate as he got better. The opioids. So what we learned from this early case was that you have to not go to the opiates or take the opiates off the patient before you cure them. So this is something, but the fact is he got in this situation because he had infection in the tissues, and my treatment brought the infection to the surface, made him feel less pain.
And what's really amazing to me about this, Dr. Weg, is that this scar was years old. It's not like it was recently healed
Correct.
Or anything like that. It was years old. It hadn't been bloody or pussy or anything like that for a very long time, and then it suddenly, because of your treatment, just started releasing all of this material.
That's correct, Megan. And do you think they would have let him out of the hospital like that? I mean, he went for a hospital surgery. This was major surgery. Nobody would send somebody out with a draining wound. You see, he was deemed, you're fine, the wound closed, but deep inside, those tissues were still infected. And my treatment allowed the body to just like when you have a splinter, and as you soak it and do all the things that your mother told you should do, eventually the thing will come to the surface, and then you get better. And that's all I'm doing.
Traditional wisdom applied to modern pain.
So what we begin to understand, in summary, this chronic pain is generated by damaged tissue that is not recovering or healing. And restoring those tissues to health will make them stop hurting. They're not going to, and as I said, once they're infected, they're not going to be healthy, because healthy tissue cannot exist in the presence of infection. So anything that reduces infection will reduce inflammation, allow healing, and eventually the pain will go away. And the opposite is true. Anything you do that favors infection is going to increase pain. And steroids and opiates, taking opiates and taking steroids, will both favor the reduction of your immunity and an increase in pain. And another factor that's not on this slide, if you're smoking, you have a strong suppression of your immunity, and you will not get better. And if you go into any of the pain doctor's offices and you ask to look at their worst patients, you're going to find almost every one of them is a smoker. And there's a reason for that. Smoking is a known suppressor of immunity.
So that's rule number one. If you're in pain, get off the cigarettes. Get off the cigarettes,
get off your pain medicine too. So here's the story. Is it that simple? Well, I have to tell you that usually the simplest explanation is usually the correct one. I mean, that's common sense. And, well, what kind of germs could cause this? Where do they come from? Well, why can't I get rid of them? And, well, isn't the inside of my body sterile? So we can answer these one after another. And that's my specialty. And these are discoveries I made over the years. What kind of germs could do this? Well, we're still looking at it. There's recently studies and discoveries of a small bacteria called MAP that is being looked at. We're looking at that. These things are called L-forms, small bacteria. We don't know the kind of bacteria. If we could, we would cure everybody. But one thing we do know, they don't like to be in a well-oxygenated area. So therefore, they probably come from areas that don't have good circulation, like behind your teeth, like in your intestines. It's probably where they're coming from. And that answers the third question. Why can't I get rid of them? Well, these things exist in a Mexican standoff with your body. Your body can't get rid of them all the way, but your body contains them. And that's the way life is in the real world, and your body is in the real world. And people don't understand, the inside of my body is sterile? No, the inside of your body is not sterile. You have bacteria floating in your blood. Everyone does. It's just a question of how much. If you're a very infected person, your blood is going to look it. And people can see when you go and draw the blood, some people say, oh, that blood looks dark. Sure enough, it looks dark because it's full of, it's not sterile and it's full of bacteria. And if you think you can't get infected from blood, well, forget about it. I mean, that's the first thing you get is an infection from somebody else's blood. Isn't that intuitive?
That's pretty intuitive, if you think about it.
Yeah, I mean, so of course the inside of your body is not sterile. And let's go on to these other questions. And how did these germs get into this painful area? Well, they circulate in your bloodstream. Hello? It's so simple. You don't have to get pricked by someone else's blood. You have your own blood to go into one bad area. And are you doing anything that caused this infection? Well, you might be a smoker. You might have bad teeth that you haven't taken care of. Or you might have done nothing. This is just a normal thing in people that people exist in a teeter-totter manner with infection hanging out but not causing any problems. Now you get into a car accident. Now you've got some swelling around your body. Next thing you know, that swelling hurts. How do you get rid of it? Well, we have antibiotics. Why don't we get rid of the antibiotics? I mean, I took antibiotics. Antibiotics only work where there's very good circulation. And if you get the right antibiotic. Now, these bacteria, they go to places where blood flow doesn't go. That's where they stay. They'll stay in behind your teeth, in your bowels, and places like that. Maybe in your prostate, maybe in the outside of your vagina, where you're not getting blood flow. You're just getting infection. So, are there exceptions to this concept? I'm sure there are, but I haven't found them yet. Whenever I investigate, it just means I haven't investigated more. I'll find that there's a source of infection. And some of the explanations is that many of the germs that we've thought of as our ubiquitous bacteria, the E. coli's and the staph and strep, and you've heard these names. These bacteria, they exist in a spore form, which is easy to understand. Now, what do you mean a spore form? Well, have you ever seen a cabbage? Did you ever see a cabbage seed? Well, cabbage seed looks like a ballpoint pen dot. Yet that ballpoint pen dot is just as genetically a cabbage as a full cabbage. Doesn't look the same. It would be on your desk. You wouldn't even notice it. If a cabbage was on your desk, you'd notice it. Now, if you go to eradicate the seeds, you might not eradicate the cabbage. Or you might eradicate the cabbage with a knife, but you wouldn't eradicate the spores. So, yes, common germs exist in various forms. And your body has reservoirs of these germs. We already mentioned that. Teeth, bowel, these are areas that are known to be a problem. And as we just said, they travel through your blood system, through your lymphatics, and probably through the oriental meridians. And they'll go to an inflamed area because of low blood flow and because they don't like oxygen. And you may ask, could my immune system be suppressed or overwhelmed? Could the bacteria themselves be overwhelming and suppressing my immunity? Of course. Of course, if you're under a massive invasion, you're overwhelmed. Yes and yes. So then you get to specific questions. And one often thinks of the paradigm that doctors are treating with, first do no harm. Well, patients ask me, I had an epidural. Will that make me worse? And I just went I just had a discussion with a doctor, and I told her my position. And she said, well, I had an epidural, and I'm fine. Well, yeah, sure, it's a Ponzi scheme. The first person that invested with Madoff did well. You know, I mean, the first person in on a Ponzi scheme does well. So the early treatment with cortisone, you get short-term benefit. It is truly a Ponzi scheme. And so then, are steroids always a bad idea? Yes. You will eventually pay for it, if not now, in some other disease fashion in the future. And then one asks, could my chronic pain from a herniated disc, but it's a disc, they can see it, could that be from infection? The answer is yes. Why is that chronic disc causing you inflammation and not being reabsorbed? People have had this disease for generations. The disc material herniates, the body absorbs it, they maybe lose a little height, but they don't wind up in chronic pain. People have herniated discs for generations. They put them to bed, they did better. But you're not better, you're in chronic pain. That's what's happening. You're getting inflamed and you have chronic inflammation from chronic infection. And yes, the smoking is depressing your immune system and making the pain worse. And yes, the opiates also cause a hormonal reduction and a reduction in immunity that will make you worse. If you take your your opiates long enough, you'll develop reduction in your hormones if you take these opiates, and you will lose your testosterone. And patients, this is a common problem. I'm getting consulted on these cases as well now.
Wow, and that's really huge. When people start to lose their hormones in addition to being in chronic pain, that's a really big deal. So many other areas of their life are affected by the hormones.
Well, this is, Megan, since I wrote this and gave this presentation a few months ago, more and more information is coming out. And I am reviewing cases upon cases where we're just seeing this. And it's worse than ever. And the sad part is that when you talk to the doctors who are involved in this, they grudgingly agree.
So they're aware that this is happening, but maybe they just haven't quite made the discoveries that you have.
They haven't made the discoveries about the infection. They know the patients are not doing well. I talk to these people, and 95% of the physicians I talk to grudgingly agree with this picture, but they have not figured out how to get out of the box.
All right, well, the next seminar that we do has to be to other doctors then, huh?
Well, it should be. It should be. So how you get out of the box, how you get the patient out of the box is you assume they have an infection and you treat the infection. And each patient's different, but you find different things that work and you try to cleanse them, try to reduce the infective load and see how they feel. And once you start doing that, as you begin to throw off the infection, the patient's own immune system returns, and they help, and the patient himself begins to help himself. And that's where we want to go. And 20 years ago when I began to experience this, and I saw the intravenous peroxide use, by the way, I still use peroxide, but I no longer give it IV. We have better ways of taking it, cheaper and safer. But that's when I began to mix and match these things and find a protocol. So my protocol dates back 20 years. And the protocol has different approaches, and we use natural and pharmaceutical anti-infectives. A natural one might be hydrogen peroxide, might be salt, concentrated salt water. A pharmaceutical anti-infective might be an antibiotic. And the oxidative therapies feature heavily because they treat all forms of infection. They're pretty safe, and although they may not get everything, they'll reduce the load. And once the load is reduced, you begin to feel better. And hydrogen peroxide is a big part of my practice. Ultraviolet blood irradiation is another big part of my practice. I use ozone therapy. I use hyperbaric. I will put patients on antibiotics and antifungals, and we will give supplements to replace some of the stuff that's been washed out or died off. And then we're going to look for the source, and the dental source is a big issue. Root canals are a big problem. It's not the only problem, but there's all kinds of sources of infection in the mouth. Just about every patient has to go and be evaluated for this. And the majority, we find sources. The bowel's another source. The fungus, the sinus areas are a source. And there are fungal locations that are also suspect. And there are other problems too. There are prostate in men, and there are scars that harbor infections. And I've got pictures of scars that opened up, and also we cultured things out of scars. There was nothing below them, but the scar opened up. Next slide, please. And we try to do things to assist your own immune system. And clearly smoking has to stop. But you also have to eliminate the pain medicines, the opioids, and all the anti-infective hormone drugs, the cortisones, the Enbrels. All this has to stop. You can't dry off when you're in the shower. That just has to happen, and it's also distressing. And your lifestyle, nutrition, your exercise, all that builds up your hormones, builds up your immunity. And we have doctors in this practice that can help us with that as well. And there are some of the doctors here are absolute geniuses at improving this.
And this is another area where just being in a location, patient's medical, that has so many different specialties in it. So the patient is seeing you for the pain management protocol. They're seeing another doctor to improve the lifestyle and nutrition. They might be seeing another practitioner here to stop smoking, all under one roof.
Correct. That's exactly right, Megan. And this is the most unique environment anywhere. We have people here who are very, very astute at replacing nutrients that have been lost. I have some training in this, but I wouldn't go near the skill level that some of our doctors have. And we have specialists here that if we have patients who are getting into withdrawal and so on, we can access these specialists and go wherever we want to go, and on and on. So this is a place where a team can be called in when needed.
And I'll introduce all of the doctors at the end. I have their pictures and their titles, so we'll address that more at the end too if you're interested in that.
So You know, when I lecture people when I've lectured doctors, I tell them patient education and what to expect is like key, because you know, here you come in to see me and you're hearing all kinds of stuff, and then you go home and we start you on hydrogen peroxide baths, and you think it's a joke, and next thing you know, your nose is running, and you've got fever and chills, and your urine smells, and you say, what did that doctor do? Well, it's key to expect detoxification from what you're getting. And this is, education and communication is so important. You can find some of my protocols on the internet, some with my name, some without my name, but you will fail unless you're guided by an experienced physician. And the protocol has to be tailored to each individual person. And you have to have access to consultations in case you need them. And if you don't get those consultations, you can be harmed. So I do not encourage people to undertake these therapies without an experienced physician involved in the care. And there's also hostile social environment out there. I mean, the AMA and many of my colleagues don't want to understand that there's a different way of looking at things, and they can be hostile. This is, you need somebody to support you with this. And the goal of this is that you take care of yourself. Not that I take care of you forever. Not that you're on medication, you come in every week and get your pills every month, and how you doing. No, no, no. The goal of this is that we clean you up, and then you go home and keep yourself tuned up, and you're fine. That's the goal, not to be here with me.
And that's a really key distinction from more traditional types of pain management and conventional medical doctors' offices. They hand you a prescription, and nobody likes to take prescriptions, really. Nobody really wants to be tied to these pills every day. But they say, doctor, how long do I have to take this for? And the answer kind of is more or less for the rest of your life, right? So what you're saying is proposing the idea that the person will actually be healed sufficiently that they don't need to be dependent to you to come in for these treatments all the time. They can actually start caring for themselves.
Correct. That's absolutely correct. And that's the whole point. Now I myself take medication for medical problems. I'm not saying that medications are bad. I'm not saying that you don't need medicines for your heart. I'm not saying any of that. I'm saying I don't want you to be needing to take your Celebrex every day. I don't want you needing to be taking your Percocet every day. No, that must go to zero.
So what we're proposing here is for you to work with Dr. Weg, or if you're not in the New York City area, find somebody like him, or maybe even do a phone consultation with him and get back on track. So you probably already realize that you are not well, right? You're on this pain medication. It's not working for you after however long of amount of time that you've been on it, and you're looking for other options. So Dr. Weg, what would you say to someone who has listened to this, they think, great, sounds fantastic, I'm in chronic pain, I've noticed that my pain medication is not working for me. What is the next step?
Well, you could give me a call. We could have a brief conversation so that we can get some idea, if you're a candidate for this approach. Most people are. I tell you the truth, Megan, you probably should come in. Even if we had somebody this morning who came from West Virginia. You probably should come in. Maybe a visit. One visit might square you away. You could get a lot from one visit. We could then I can manage you long distance once I know you and you know me. I can work with you long distance. Or what I've done in the past is I've worked with a local doctor. But you need to come to me. You need to see me. I'm not really that comfortable doing. I'll talk to you over the phone, but I'm not really that comfortable taking care of you because it's a bit much. It's a bit much without establishing a patient-doctor relationship. Once you've got that established, I have no problem working with your family doctor, talking him through things. I've done that in the past.
Great. So there's lots of options, but it really begins if you're far away. Start with the phone call. Call in. At least make sure in your mind that this is the direction that you want to go, and Dr. Weg will do a very brief phone conversation with you to make sure that you're going in the right direction. And then you'll come in sometime. Take a trip to New York City. This is a great place. So many tourists come here.
Well, you make it a joke, but it's true. If you land at LaGuardia Airport, you can be in this office in 20 minutes and be back on the plane, going back with a whole education and possibly some other good stuff with you. I mean, there are other doctors doing similar things around the country. I don't want to. They're similar. There are some very good oxidative therapy doctors. There are some very good alternative doctors. There are some very good pain doctors. But I am the only one that I know who does this particular protocol. So until I have somebody that I could say in California, this person will absolutely follow my protocol, I can't directly recommend you.
Absolutely.
Second, though, if you come here and we've got you focused, then you can even probably go to your family doctor if he's willing to work it out.
Mm-hmm. Great. So there's definitely lots of options for you to receive care from Dr. Weg, all that we can tailor to you. And just, call us. Let us know that you're thinking about this. And my name is Megan. I can speak with you and help figure out the logistical aspect of it. But we just want to make sure that you have access to care that you deserve. So the first step is, beyond calling me and getting the logistical issues out of the way. Dr. Weg is actually offering a consultation for 30 minutes to just discuss what's possible. And then the second step is, if you like what you hear, schedule an appointment for the full office visit, which can include your first oxidative treatment if that's what Dr. Weg feels is the next step. Or if you already know that this is what you want to do, just skip the first step. Come in, have the full consultation, get started right away. So Dr. Weg, do you want to say any more about how this works, the first step, second step, working with you?
Well, I can tell you that if you're not feeling better within a few weeks of coming to me, I don't want you coming back.
The proof is in the pudding right there.
Yes.
Mm-hmm.
I want you to start feeling effects within a week or two. If you're not feeling it, of course, you have to follow my directions and my guidance, but if something's not happening within a week or two, there's something wrong. Either you're not being directly straightforward with me, or you will be one of the few people I've ever met who absolutely does not respond to my therapy, and I don't think you'll be the first one.
Very interesting. Yep. So Dr. Weg, I'm very confident that he can work with the people, and of course, feel free to give a call, and I can help guide you in the right direction if you're looking for where to begin exactly with that. Especially if you're listening from far away. Most of you are probably listening from very close to us in New York City, and in that case, Dr. Weg is here every week. Such as call Patients Medical, and I'm going to give you the contact information in just a few moments. You just call right in, and we can get you scheduled with him so you can start feeling better sooner rather than later. As he said, his protocols work very, very quickly for many people. So there's no time like the present. Might as well start, right? So let me tell you a little bit about the other members of our team here. You can see Dr. Weg here, our alternative pain management specialist, but we also have Dr. Rashmi Gulati, our medical director, Dr. Kamal Kokai, he does holistic and Chinese medicine. He also heads up our stem cell therapy center as well. So if you're interested in stem cell therapy, we actually have that going here at Patients Medical. Dr. Weg is actually on the stem cell therapy team as well, which will probably be a whole nother different discussion. We have Dr. Marcia A. Harris. She's a holistic gynecologist and internal medicine, anti-aging. We have Dr. Vivian Denise. She does integrative internal medicine and pediatrics. We also have a psychopharmacologist. That's Dr. Eileen DiFrancesco. We have holistic oncology and immunology, Dr. Gino Bettino. We have Dr. Paul A. Dreshnik. He does plastic surgery as Dr. Victor I. Rosenberg. And then we have another holistic gynecologist, Dr. Eltiana Howard, here on staff. So those are just the physicians that we have here. We also have staff members I'm not going to go through right now, but if you're curious, go to patientsmedical.com and you can read the bios for each and every one of these physicians, along with our other staff members. I'm going to show you where that is. You go to Our Physicians. Right here, it's the second tab from the left when you go to patientsmedical.com. You can read the full bio, see the picture. In some cases, there are even personal narratives about how that doctor came to holistic medicine, which in some cases is very, very interesting. But then also read about their educational background, which I know is very important as well. And after you read all of that, you can get more information that our doctors contribute on our blog. So this is our most recent blog as of today, January, How to Survive the Flu Season, 11 ideas from our holistic doctors. But we actually pull information directly from our doctors and then give it to you in the blog so you can read it anytime, anywhere, which is really great. We also have recordings such as this one, such as this webinar, and maybe possibly other things that are your area of interest, right in our resources. And so just click on this tab, Resources, and then you'll get to videos, webinars, download articles, and much more other things that may be of interest to you for Patients Medical. And Dr. Weg is featured on some of them, as are other holistic doctors. So I am guessing that you're really excited about Dr. Weg and his alternative pain management protocols. So go ahead and give us a call at 212-661-4441. We'll answer your call and get you scheduled with Dr. Weg, or at least get you over so you can speak with him over the phone briefly to make sure this is right for you. Or if phone isn't the best way for you to communicate, email us at media@patientsmedical.com. That is MEDIA at patientsmedical, PATIENTS, medical, MEDICAL.com. That'll come straight to me or one of my colleagues, and we'll be able to hook you up with the information that you are looking for. So thanks so much for joining us for this presentation. Thank you, Dr. Weg, for joining us and sharing your extensive experience and expertise here with us today. So alternative pain management, come to Dr. Weg here at Patients Medical, and we look forward to speaking with you soon.